Hi, my name is Joel Persson and I'm a PhD candidate at ETH Zurich in Switzerland. I'm going to be presenting our submission, Learning Optimal Dynamic Treatment Regimes Using Causal Tree Methods in Medicine, which is joint work together with Teresa Blumlein and Stefan Feuriger. So dynamic treatment regime is a method of personalizing sequential treatment decisions. So consider the following example. At time point 1, a patient arrives at a physician who observes some information about the patient. Given this information, the physician prescribes the patient either the treatment condition or the control condition. At a later point in time, the patient again arrives at the physician, who then uses the initial information plus the either positive or negative response to initial decision to make a new treatment decision. The objective is to learn the so-called optimal dynamic treatment regime, which is the sequence of decision rules that, if implemented, would maximize the expected outcome of the patient at the end of the sequence of treatment decisions. So now consider instead that the physician observes multiple heterogeneous patients, for instance, those that differ with respect to gender. Then we know that the heterogeneous patients may respond differently to the same treatment decisions. We also know that if there are sequential treatment decisions, then the same patient can respond differently depending on where they're at in their treatment regimen. So an optimal dynamic treatment regime only assigns treatment when and to whom it is beneficial. And in that way, it personalizes treatment to patients over time, given their heterogeneous information and how they dynamically respond to the different treatments over time. So common methods for learning optimal dynamic treatment regimes have shortcomings. Some of them use outcome prediction and not heterogeneous treatment effect estimation. Other methods that are based on estimating treatment effects use linear models, which are restrictive for the complexities of modern electronic health record data. Methods that then allow for complex relationships, such as those that are based on machine learning, are typically black box and thus not explainable to medical practitioners and can thus not be implemented in practice safely. We thus propose two new methods, DTRCT and DTRCF, that are based on causal trees and causal forests that we adapt to learning optimal dynamic treatment regimes. These methods learn nonlinear relationships, they adjust for time-varying confounding, are data-driven, doubly robust, and can be explained to medical practitioners. We find that our methods outperform state-of-the-art baselines in simulation studies and can improve on the treatment decisions from real-world medical data. We invite you to check out our work further in our booth. Thank you.